of this, which started back on 6th of July and is now ending on 12th of August 2024. This is the 15th and the last webinar of all that series, and the previous ones are available on our YouTube channel, that is SRC Research Cell Khyber Medical College. We are today gathered here for the one and only topic, that is on qualitative research study designs by Dr. Imran Marwat. My name is Furqan Sethi, and I'm a third-year MBBS student at Khyber Medical College. With this, I would like to give you an introduction of our esteemed speaker, Dr. Imran. Dr. Imran is Assistant Professor in the Community Medicine Department of Khyber Medical College. He has an MBBS, a Master in Public Health, a DDMP, a PhD in Public Health, and today he is going to enlighten us with all his experience in the field of and qualitative research and study designs. Sir, I think this is time to take the floor, and you can formally begin your session. Thank you so much.
Thank you, Furqan. Thank you, Furqan. Thank you for introducing me. And while you were introducing, you said that Masters in Public Health and DDPM. Let me tell you what is this DDPM. DDPM means Diploma in Disasters Preparedness and Management. So this is one of the qualification I have. And I welcome you all, very warm welcome, and good morning to all the participants who are sitting over here for this, our last webinar. And I hope those who are here in Peshawar, there's very pleasant weather today. I think the end is very pleasant, and I hope the start was good as well. Before starting my today's presentation, I will recite few verses from the Holy Quran. A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. Rabbi shrah li sadri wa yassir li amri wahlul 'uqdatum min lisani yafqahu qawli. So our today's session, that is about qualitative research. Qualitative research designs. Okay, so today we will discuss that what is qualitative research. Very few of us are aware of this qualitative research designs, because many of our undergraduate students as well as our esteemed faculty members, post-faculty members, postgraduates, they are mainly involved in clinical sites. So they are mainly involved in analytical studies and descriptive studies like cross-sectional studies, case series, case reports, etc. But very few of us, only those who are linked with medical education department, are those who are pursuing their diplomas or masters in this medical education, they are a little bit aware of this qualitative research, because it is totally a different field or area, you can say. And here in our setup, it is very not properly explored, I mean to say. Our today's session's primary objectives, that is to distribute CMERs, because many of us, they are sitting over here just to grab that CMER, which is linked with this webinar series, because our esteemed faculty members, they require a number of CME credit hours at the end of the year in order to submit their annual confidential reports. So that is the primary objective, I think. And the secondary objective to many of faculty members, I don't know about the students, but maybe they are interested in the certificates. So the secondary objectives come that what are the different concepts involved in qualitative research. While talking about the research, whenever we start thinking about research, when we think that we are going to start the research, it's very mesmerizing, and it gives us goosebumps, like one considers himself or herself like an Einstein, that at the end of the research, I'm going to discover something new or to establish some new theory. That is at the start. But what comes in reality, if you want to add something quality things to already exist existing body of knowledge, then it is very difficult thing, because not impossible, but very difficult in our setup, because we don't have resources are scarce, we don't have financial assistance. So in reality, it is not very simple to produce some quality thing as from research perspective. I will just start with a few slides of just the baseline information that how we start our research. This is just the template, or you can say the different headings involved in a proposal development. A proposal is basically that blueprint which is drafted prior to a research conduction. And it tells you that how you are going to conduct your research. And it is mandatory here in our setup that you have to submit your proposal to the IREP department to grab an ethical clearance, because you cannot collect the data without getting that ethical approval from the department. And this proposal has some few sections, because after doing a vigorous literature search, you have to identify the gaps in the literature, and on the basis of that, you develop that this is the area which needs to be further explored. And you can see that we start with selection, analysis, and statement of the problem, then literature review. A very important section of a proposal, that is the methods section, where it has some different headings, including variables, types of the study. So today we are more linked over here, that qualitative research study, because we are talking about the different research study designs. And this is the area where today we will discuss that what is the qualitative research, because when we are going to draft our proposal, it is same just like quantitative research or other research like cross-section studies we are mostly aware of, and our case control or cohort study or any experimental cohorts, I mean to say randomized control trials, non-randomized control trials. So this is just like the quantitative research study. You have to develop a proposal that you have to submit it for ethical clearance. This is the organogram, you can say the flow chart of different research study designs. Basically, broadly, we classify research studies in descriptive and analytical. And in descriptive, again, I think many of us, we are aware of what is case report. When single case comes, unusual single case, when people report, that comes under case report. And then when few more cases comes of the same disease or from same area, that it becomes case series and then cross-section studies. And then analytical by analytical, we means when we are comparing two different groups. If we are just observing those two groups, it comes under observational analytical studies. While if we are intervening in those groups, we are doing some kind of experiment. We want to introduce some new drug, new procedure, new operation procedure, etc. So it comes under experimental, randomized, and non-randomized control trials. This is analytical. Qualitative comes under this descriptive part, because we are going to describe things. Now, there are two main things, like we say that in a human being, one is genetically acquired traits that we acquired from our parents. And then second is there is socially, you can say, acquired with the passage of time. When we grow from childhood, we learn many things. And those are 5, 6 senses, they play major roles in our experience, in our every day-to-day life. So by just watching, we can learn a lot of things. Okay, and this qualitative research is mainly involved with this kind of, you can say, this is one of the data collection tool. For example, in phenomenology, we use just simply we observe things, and that is by watching and then recording things. Or I will discuss it later on, that what is phenomenological study design. From where this qualitative research originated, here I am going to introduce. At this very moment, there are few terminologies linked with qualitative research studies, and one is like ontology, epistemology, positivism, interpretivism. With few slides coming, okay, and then we will discuss that what is positivist philosophy and what is interpretivist philosophy. Here you can just keep in your mind that this positivist philosophy, that is linked with quantitative research studies, okay, that whatever studies, cross-section studies, or if we want to find any causal relationship between cause and effect, it is linked with that positivist philosophy. While interpretivist philosophy, that is linked with qualitative research study designs. So this was just the qualitative research studies, they were developed in reaction to those positivist philosophy. I mean that in order to respond to the quantitative part, quantitative studies. And then this different research approach is required to study. Like in our day-to-day life, there are a few things that we cannot quantify, like our beliefs, like our different cultural beliefs, norms. We cannot study those in the form of quantity. I mean, we cannot study those areas with numbers. Now, there are some basic concepts like these scientific paradigms. Now, scientific paradigms, or you can also call it philosophical worldview. It is a very broad set of beliefs because each paradigm includes different sets of ontological and epistemological beliefs. And it connects and categorizes a variety. I mean to say that at this very moment, these are just terminology. I want to introduce you people to few of the terminologies because it is very broad. In qualitative research, this is the most, I mean to say, a dry area, that what is theoretical framework, what is the conceptual framework. Because this qualitative research, it was basically linked with anthropology and sociology sections. Later on, it was introduced to the health department, public health field. Now, this scientific paradigm, it connects and categorizes a variety. Few people have... Good question. इसका जवाब मैं आखिर में दूंगा. Scientific paradigm connects and categorizes a variety of research techniques through underlying philosophical assumptions surrounding appropriate research practice. ठीक है. अब यहाँ पे at this very moment, I want to introduce you to the ontology and epistemology. What is ontology? Ontology is basically term used that there is a reality. Okay, and what shapes that reality? Because this qualitative research, it is linked with our surroundings, day-to-day life. So we believe that there are some reality, and that reality is either fixed, or you can say that reality changes with time, or our beliefs play a role in that. Now, that ontology, what is reality? What shapes reality? And what is the interconnections or connections between different philosophical, I mean to say, assumptions, how the reality is created. Now, epistemology is the philosophical debate about the nature of knowledge, that how you are going to study that reality, that yes, the reality exists. So epistemology deals with exploring that reality. Okay. Now, methodology specifies how the researcher may go about practically studying whatever or he or she. Because we are mainly linked over here with, we know the methodology section, because many of us, they are mainly involved with this. While drafting the proposal, we know that introduction section, rationale, what are aims and objectives, and method sections. Now that method section describes everything. Now that methods is basically in qualitative studies, that is use different tools or techniques or ways in order to explore by using different epistemological assumptions, phenomena, that what is the reality, how you are going to explore that reality. So in terms of qualitative study, methods means that thing. Now, research paradigms, there are two different. If quantitative, in previous slides here, I told you people that it was developed as a reaction to positivist philosophy. So here you can see that this is the research paradigm, or you can say philosophical worldviews, okay? This is another term used for this research paradigms. And this is very broad term. And then in the quantitative part, this is the positivist. Let me further explain that positivist and interpretivist theories in upcoming slides. And then qualitative, it is linked with interpretivist, or interpretive theories. Now, positivist philosophers, they argue that there is a causal relationship between cause and effect. This is that you can quantify things, like you can say that why the disease is occurring. Okay, the number of patients admitted in a hospital. Okay, so as an organism surrounding precise empirical observations of individual behavior in order to discover and confirm a set of probabilistic causal laws that can be used to predict general patterns of human activity. Okay, now empirism, what is empirism? Argues that only that which can be experienced through our senses. Okay, now positivist research gained dominance in the natural sciences and was later adopted in social sciences. I mean, in simple words, you can say that positivist paradigm, it is more linked with quantitative research studies in which we can find out the causal relationship between cause and effect. While contrary to positivist, that is another interpretivist approach argues, I hope that this is just few slides, which are a bit tricky, I mean to say, because you people are not aware of these terminologies, but I just wanted you people to introduce you to these terminologies. Previously, I was of the view that I think I should not give, but later on, I realized that at least you people should know about these different terminologies which are used, because there are some theoretical and conceptual frameworks used in qualitative research. Now, interpretivist approach argues that research should be explored. It should explore socially meaningful action through direct detailed observation of people in natural settings in order to arrive at understandings and interpretations. Like ethnography is one of the research study designs in which the researcher stays in the local settings, in the people. He immerses himself or herself in that surrounding, in those settings, and he simply or she simply observes that what is happening, what are different rituals, what are different cultural norms of that area, what are different. So by just studying, for example, if I want to link this qualitative research with, for example, I'm introducing a family planning project to an area. So before studying the cultural norms or concepts or beliefs of that area, because maybe those people, they are more religious side of mind people, and they do not want this family planning thing in their setup. So what are the different ways that you want, what is the, that how you are going to improve your output? Because the resources are very limited. If you are going to implement that research study or implement that project that you are going to launch a family planning project, and later on you realize that this is not going to work over here. So before launching that project, ideal thing would be that you do an ethnographic study. You should thoroughly study the concepts of the people, what is their culture norms, what are their beliefs, and then later on you can understand that what are the areas should be tackled. You should involve the maulanas, you should involve the peers, you should involve the elders of that area. So later on you will see that yes, now this will work. So this is ethnographic study. Again, I will discuss it in the research study designs of qualitative research. This was just to give you the glimpse of that, one of the research study design. So we use methods that try to describe, interpret people's feelings and experiences, etc., etc. Now, this flow chart, or this which is socio-cultural disciplines and theories, the methodological field. This is just to identify, like here you can see that positivism and interpretism, again, same terminologies. Now, just consider this positivism a quantitative research with which we are more aware of, or which we usually study in our setup. And this is the qualitative research. Now see, this is the epistemology's paradigms. Positivism, interpretism. This is quantitative research, this is the qualitative research. What we do in positivism, we test an hypothesis. We test that, yes, bottle feeding leads to increased diarrhea in infants. This is one of the hypotheses, and then I can only find this relationship by doing a quantitative research studies, that how many children they are breastfed, how many children they are bottle fed, and what are the results later on. So we are just testing an hypothesis. We aim to establish, explain, predict causal links between key variables. While contrary to this interpretivist qualitative research, what we do, we thick description and in-depth understanding of the phenomena or context or surroundings. Okay, we cannot quantify things. When we cannot quantify things, we can just describe those things. So we will rely on this qualitative interpretivist area. Here, this is the quantitative part. But what are the different methods involved in both areas? For example, in this quantitative part, this is the methodology section, okay? That we aim to establish the causal relationship. Here, we just want to describe some phenomena. Now, surveys, again, these are the research study designs. Experimental studies, like RCTs, randomized controlled trials, experimental, quasi-experimental, non-randomized controlled trials, questionnaire-based structure observation. By structured observations, we mean that we have a set of questions, and then we just follow those set of questions, etc. And then quantitative analysis, we use different softwares like SPSS, Stata, R software. in order to quantify or in order to apply some inferential statistics on that area. Well, and here in qualitative research, these are the different research study design: phenomenology, ethnography, life history, discourse analysis, case study, participant observation. These are different. And then we just simply, by doing the focus group discussions, by in-depth interviews, by key informant interviews, by just taking the field notes, field diaries, photographs. These are the different data collection tools here used in the qualitative area. Okay, now this diagram was just in order to this is the just two different this is the just two different areas, positivist and interpretivist areas, and what is the interrelationship between these two. Now, again, this is another thing, what is inductive and deductive areas. Inductive and deductive. In deductive, what we do, that we verify things, or in other words, we quantify and quantitative studies. There is that deductive way of conducting a research. While qualitative is to analyze things and to develop a theory, this is the inductive and there is the qualitative. Let me show you another slide, and here it will be a bit more clear to you people that what is the difference between quantitative, what is deductive and what is inductive. In quantitative research studies, which is deductive in nature, we start with the theory. Okay, that there is already theory is there, and that theory is developed from the qualitative part. Here you can see this is the end part of the qualitative research. Now, based on this theory, we just develop a hypothesis, and that hypothesis is later on through different methodological sections, like using different tools, different questionnaires, and different tests are applied, etc., etc. And then observations collected and analyzed, and then we confirm that whether this hypothesis, we are aware of null hypothesis, alternate hypothesis, and hypothesis. Now, at the end of the day, we have to either reject or accept the null hypothesis. So this is the quantitative area. We start from the theory, and it is the end part is to confirm that hypothesis should be rejected or accepted. In qualitative part, we start with an observation. Okay, like we see that why I mean to say that people, they are reluctant to immunize their children in tribal areas. So this is just an observation, my observation. Now let me check that what are the different cultural norms which are involved. Maybe there are some beliefs, religious beliefs, or maybe there is something which is in their mind that this immunization, this is not I mean to say, this is not, doesn't work, this is not worth of, or this is their impact is negative. So there are so many different religious perspectives, from cultural perspective, from social perspectives. So those are different observations, and then patterns, and what are the hypotheses. Okay, and then we generate the theory. So this is the inductive part of inductive process of qualitative research. Now this from here, I'm going to start that what is a qualitative research, because in last slides, I just give you people that what is quantitative, what is qualitative. Now you people will have an idea in your mind that what is the broader difference between quantitative and qualitative. Quantitative, positivism, and while qualitative, that is interpretivist phenomena. Rudyard Kipling, he was born in British India in 1836. He was short story writer, and the famous Jungle Book he wrote, and he was also awarded the Nobel Prize. And he in one of the book, he says that I keep 6 honest friends, which tells me a lot, and which solves problems for me. And those 6 friends are what, why, how, where, who. So there are 6, but out of those 6 different words or different friends, what, why, and how, they are linked with the qualitative part, because you cannot say that why it happened. Okay, so you cannot quantify this thing. This is just a socially, or you can say that you have to study this in your words. You have to describe what is happening, why it is happening, how it happened. Okay, blast occurred. Okay, so what happened? The blast occurred. Why happened? The reason was that recently for example, you people will be seeing watching on the media that due to some low quality gas which is used in this air conditioner nowadays, they are responsible for these blasts. And in last 1 year, 14 people died in Pakistan. So I'm just giving you an example and how it happened. So these are these three questions. If you are focusing on a qualitative research, these are the three areas you have to explore. Now, qualitative researchers study things in their natural settings, attempting to make sense of or interpret phenomena in terms of the meanings people bring to them. In other terms, you can say that the goal of qualitative research is the development of concepts which help us to understand social phenomena in natural. Now, you people at this point, you people will be saying that I think I'm talking about the sociology section. Yeah, it is more linked with sociology department. But while I will be discussing the different research studies designs, I'll give you the examples of the published research studies. I have published few of the qualitative research studies in a very good reputed international journals. And then you will see, and then you will realize that, oh, this is an area that we can also explore, because currently many of the undergraduate students, they come to me and they say that, sir, we want to conduct a research study, but ideally it should be of good quality, but of less time consuming and less with less resources. So I say, if you're talking about the quality, and quality requires some definite things, like you have to put some good resources, financial resources. Otherwise, it is not possible that in very short span of time, you cannot conduct a quality research study. So the qualitative research studies, the findings describe findings through words rather than numbers, and seeing world through participant perspectives. Ultimate goal, all these different areas, concept, definitions of qualitative research, it will be clear when I talk about different research study designs, that 5-6 different research study design. Commonly called interpretive research, is methods rely heavily on thick verbal descriptions. Here in qualitative research, the result section is purely based on description. For example, in quantitative research, what we do, we just describe our results in the form of tables, graphs, like this is the pie chart, this is the bar chart, this is or we apply different tests. But here we do not apply different tests. We simply describe, or we quote the exact words of the participant. When we are interviewing a participant, what we do, we record the interviews, or we note down the recordings later on, and then we transcribe them, and then we later on in the result section, we just in exact words are quoted of the participants. Like, for example, one of the questions, that why you are not using this family planning methods, why you people are not opting for that. Now there is some culture, for example, one of the female participants, she will say that because religiously, I think this is not suitable for us being a Muslim, that we should use this family planning method. Now here, what you do, you cannot quantify this thing. You just have to describe what is there in their mind, of their people mind, that this is the misconception that religion says that this is family planning, it is prohibited in our religion. Now, what is the appropriateness of qualitative research? When variables cannot be quantified, best understood in their natural settings, studied over time, roles, processes, groups, we study when different groups, different processes, different roles of the groups, etc. Few differences from qualitative and quantitative research, that it answers the how and why questions. Qualitative part, who, what, how much, this is the quantitative part. Participant perspective, this is the research perspective, because when researcher is interested to study few of the variables, okay, for example, I'm interested to study that bottle feeding leads to this increased diarrhea episodes in infants. So what are the variables? The variables are bottle feeding, diarrhea, infants. These are the different variables. Maybe that is in rural area, in urban areas. And here, this is the participant's perspective, that if female is not practicing breastfeeding, and if she's not feeding her child, then what are the reasons behind that? Maybe she is anemic, she is very weak, maybe there is some misconception, maybe there are so many different areas if you want to explore. Now that part will be from the participant's perspective instead of researcher's perspective. Explore hypothesis. This is confirms hypothesis. It describes the qualitative part. It describes in the form of text you have to give to describe the result sections. Here you have to quantify what is the standard deviation, what is the mean of the sample, okay, and then you generalize the findings. Here you in qualitative studies you cannot generalize findings. For example, I am studying this family planning project conception, their beliefs about family planning in tribal areas. Do you think that I can apply the same thing here in Peshawar or urban area of Peshawar? No, this is not generalizable. But if regarding this the number of illnesses, yes, you can say that the breastfeeding or bottle feeding leading to the increased number of episodes of diarrheal cases. So yes, you can generalize this in different areas. Now, common methods includes focus group discussions. Focus group discussion means like 8 to 12. Normally 8 to 12 participants sits, and those 8 to 12 different participants, they are from the same area, from the different areas. Like one is the school teacher, one is the shopkeeper, one is the vendor, one is the, so there are 8 to 12 different from the same area. And then you have to, there are 2 different people sitting, one is recording and that is a kind of, you have a guidelines for that focus group discussion, that how you are going to conduct this focus groups discussion. Individual interviews, there are 2 different individual interviews, like in-depth interviews and key informant interviews. For example, I am interested to study the health system of local health system of Khyber Pakhtunkhwa. Now, ideally, I should opt for key informant interviews. I should interview the secretary health, the DGHS, the health sector, the chief secretary, or you can say health minister, or the chief HSRU, health sector reforms unit. That is the key. Those people whom I'm going to interview, they are the key persons to give me the exact what is going on, what is the health system. But do you think if I interview a person sitting here in KTH and he is a doctor, maybe he's assistant professor or associate professor, and he's more linked with clinical side, do you think he will be in a good position to give me the details of the health system? No, he's not. Because that is the key informant interviews and in-depth interviews. In-depth interviews, for example, I'm studying what are the maternal health, for example, that is poor maternal health. Now let's see, I am going to see that what are the 3 delays, that what delays means, that what are the logistics provided in the primary healthcare, etc. Now the participants or the females coming to the LHV, I can interview them. There, that is in-depth interviews comes in that area. And then is observations. There is another area in qualitative research that is called field diary. You just go to the field, you just see that, yes, you can take the picture, or you can simply observe things that let me check that LHV is available in the primary healthcare or not. What are the situation? What is, you can just take the picture of her table, that what is there on her table. Okay, so this is just the field observation. This is also a qualitative research part. But here in quantitative, we have a set of questions, like we develop questionnaire, that this is the semi-structured, structured, and which we give the Likert scale. They have to opt for 1. We have the number. So there are so many, that is linked with quantitative part. Here in qualitative part, the sample size is small. But usually in quantitative part, because we have to generalize the findings, for that you have to give a proper sampling procedure is carried out. And that is sample size is calculated through different techniques like EpiN4, etc. Here, what you just identify the people that whom you are going to interview. And then saturation is the key word which is used, that maybe at 10th or 12th interview, the saturation occurs. There is no new phenomena is arising from your questions. Participants are not sharing something new. New information is not shared by them. So that is at that point we say that saturation occurred. So that is that becomes the sample size. So we cannot determine the sample size. Yes, we can calculate, but ideally the sample size in qualitative studies, in in-depth interviews, in key informant interviews, we simply go for saturation. Now this is a question for you people. Let me see that how many of you people are sitting and they are listening. Would you conduct a qualitative or quantitative study? The research question is, does the postnatal health education program in Peshawar improve the health status of infants? Audience, people sitting and watching this webinar. My question is, does the postnatal health education program in Peshawar improve the health status of infants? So are you people going to opt for qualitative research study or quantitative research study? और फिर लंबी खामोशी छा गई है ना अच्छा मैं बता देता हूँ
qualitative.
You say qualitative. Okay, let me for example, I say that indicators are used to assess the improvement in a health status or in the health system. Whenever we study a different health system, we go for few of the health indicators, and those indicators, the two main indicators are maternal mortality ratio and infant mortality, or child mortality or neonatal mortality rate. So the infant mortality rate is probably it's 64, 65 per 1,000 live births. Like children who are dying out of 1,000 in 1 year, that is 64 children, they will die before reaching to their first birthday. So this is just a number. So if you have launched a postnatal health education program, you cannot say that after this education program, can you say that, yes, the health of the children, yeah, infants, it improved a lot. This is, you cannot quantify. Ideally, this question is asking about the quantification. That yes, later on you can say that health education program was launched in which we give the health education about the breastfeeding. Later on, we calculated, yeah, what was the infant mortality rate of that area was, for example, 40 or 50 per 1,000 live births. And after 1 or 2 years, then initially output was this, yes, we delivered this message to majority of the females of this area. And then after 5 years, we realized that infant mortality rate decreased to the 30. Now, this is linked with quantitative part. Like we had in our mind that initially the infant mortality rate there was 40, 50, and then after launching a program and then later on seeing the impact of that program, we found that 30 or 20 or 25 people, they died, children, infants died. So this is quantitative study you should opt. Would you conduct a qualitative, quantitative study in this question? What are the experiences of parents with autistic children at Khyber Teaching Hospital? Can you quantify the experience? No, you cannot quantify the experience. Because are they depressed? Do they have problems, anxiety problems? Because those who are, recently we published a qualitative research study on this topic, that is respite care with mentally retarded children, the parents or attendants who are looking for, you can taking care of those children. They have their own problems. We do not consider. So that research study was conducted in Islamabad. It was just recently published in July in a W category journal. I will share that as well. Now, these are the 3 different steps which are involved in a qualitative research. When you are going to conduct a research study, you start with an goal that access the participants' word and meanings. Because in quantitative research, I told you people that researcher himself or herself has to immerse herself or himself in the settings, and then they collect the data. Conceptualize and study planning. That is simply that proposal, which initially the first slide was that proposal development. So you have to develop that proposal, that what is the problem or what is the observation. And then after drafting that full proposal, that how you're going to conduct that research study, there should be purposive sampling and data collection. By purposive, this is a non-probability sampling technique in which you have to select the participants purposively. Because if in previous, like in this area, if I'm interested to study the experience of parents with autistic children, do you think that I should interview any parent? Ideally, not ideally, yes, definitely I have to interview the parents who are suffering, whose kids are suffering, whose kids are autistic children. So they will be the proper persons for me to give the proper information. So that is the purposive sampling. Okay, and then data collection. Data is collected through interviews or through recordings or through, there are different qualitative, I discussed that. Maybe that could be a focus description. And then again, thematic analysis. Like in quantitative study, what we do, we just put the data in, we draft variables in SPSS, we put the data, and then later on it is inferential statistics, we apply different statistics, we develop pie chart with different tables. But here what we do, we just transcribe things. Transcription is the proper way. Yes, there are few softwares like NVivo is a software freely available to develop, to analyze this qualitative research studies. I think this is not the proper time or proper webinar for me, but I think there is a proper, ideally in pre-research conference workshops, I think I will ask the chairman, Dr. Iqbal Haider, who is looking for that research cell. So I will associate dean research, Dr. Iqbal Haider, that yes, why not, that there should be one pre-conference workshop on this NVivo, that how we put the data, how the transcriptions, how different themes, codes, they are developed through that. So that is thematic analysis. In thematic analysis, this is properly, you have to develop different themes. You have to subcategories, categories, and later on themes are developed. And under those themes, you have to describe the results. Now, common qualitative methods: observation, interviews, I discussed that in previous slides, and focus group discussions. Different data collection techniques. Now this is a bit different, difference between methods and techniques. Methods, either that is quantitative or qualitative, while the data collection technique is the how you are going to collect the data, like note taking, field note journal, structure observation, brief notations while in the field, video and tape recording, etc., etc. Research questions are open-ended, okay, but you have to develop the interview guide, that how you are going to progress your interview, that you have to start with the greetings, and then you have to introduce yourself to the participants, and then later on you have to ask, the first question should be rapport development, like how you are going to develop your initially, because he or she will be reluctant. Maybe there are some ethical, for example, if you are studying this family planning concepts regarding the family planning in that area, yeah, cultural concepts. So there is a bit ethical, ethical sensitive area. So initially you have to develop your report, and then later on the first question should be like this, and then second question, third question, that you want to explore, or you want to, the in-depth interview should be conducted, that what are the concepts. Now begin with how, why, in what ways, many may change over time. Very 2-3 few slides are left, but I'm over with my presentation. Rapport, again, establishing a mutually trusting and respected relationship with participants. Depends on culture sharing group, participants, interviews. There are different 4 stages. That apprehension, that initially sense of you can say that they are not very much, they do not want to be open to you. They doesn't share their full information with you. Sense of, insecurity, that is the first stage. And then now this is the point, that how you are going to develop your interview guide, that how you are going to break that ice, that how you are going to extract the information from that participant. So later on, then explore, then cooperation, and participation is the last stage. Now it depends on the interviewer, that how he has the, does he has the, very much like, is he that much competent enough. ये तो होम मिनिस्ट्री बोल रही थी. Anyhow, participants जो है ना, at the end, last step, fourth stage, that is the participation. Okay, cooperation, and then last stage is participation. Now, maybe the qualitative research, who is conducting a qualitative research, we end up mostly with at this stage, that cooperation. Ideally, I will give you an example. For example, you people have watched different programs on National Geographics, where one of the person, he lives in a tribal areas, in African tribal areas. He stays over there. He studies he observe the rituals of that tribe, and that is ethnographic study. Okay, so that is the participation, that you have to, that researcher should actually participate with the participants. Okay, and then later on he realizes that yes, now they have passed through apprehension stage, and the second stage was exploration and cooperation, and at the end they developed the report in a way that they properly participated. I think this is called probing question, that how you are going to extract the proper information. Direct questions, how, why, what you mean, verbal expressions, nodding. You have to note down all these things, because you just see, like, for example, you can say that, yes, I agree to this. Okay, but your expressions are not, there is negative expressions, like, yes, I agree to it. Yeah. No, you see, those different things. One is like, you can say that, yeah, I totally agree. Yes, you are right. You are right. Now, this is one thing. While verbal expressions, you are in a very, you're furious state, like you're the same words, but the meanings are totally different. Okay, then mirroring technique, echo probe, repeating prior point. Okay, probe, like remaining quiet. You just give the time to the participants that he or she should say something more. Okay, just give the time to her, or to that participant. Exploratory probe. Oh yes, what else? What happened then? This is the exploratory. You want to explore more and more. What happened? What was the initially stage of that? Like, for example, I studied the IDPs in Jalozai IDPs camp. So while I was exploring, I just asked them, okay, so what happened? Why you people left your areas? So they said initially that, like, the bombing started and we were reluctant to flee our area, but because many of our colleagues, they died because there was few just firing and shelling, and then okay, what happened then? Okay, and then so you keep on asking that, what else, what happened, how you reached over here to this camp. So that is the process, that after at a span of 1 week, what happened to that person. So this is kind of exploratory questions. Then baiting phase assertions probe, like hint, you are already giving them hint that, okay, so you must have experienced. Okay, so you must have experienced difficulties while getting to this camp. This is just kind you are giving them. Was there any problem with registration process? No, I am aware, because there was limited tents were available, so they were reluctant to give the registration to each and every. So they were just here in KP, the Jalozai IDPs camp. So this is just you are giving them a hint, and then you want to explore that what they are saying. Now, triangulation is another word, that how you are going to triangulate. You just want to see that there are three different things, like there are either multiple data collection strategies. I discussed with you people, that is, what is focus group discussion, one is in-depth interview. These are different strategies. Now, there could be some different kinds of data. Like one is the verbal statements, yeah, their interviews, guides, etc. And then is another thing, that is field observation. You just simply took different pictures from the area. So this is different kind of data. Okay. Multiple data sources. You studied, yeah, I mean to say, you interviewed the participants. For in our setup, I interviewed those IDPs. Later on, I realized that I should also interview the district health department, like DHO, the different health facilities which were nearby to that Jalazay IDPs camp, what they think, and different kinds of data. You have to, so what does it mean triangulation? That maybe that participants, okay, while giving the interview, they are just, they just, there is one bias that is called reflexivity bias. For example, that I encountered in my interviews. What is reflexivity bias? Because when I was interviewing those IDPs, that was in a 2018, probably 2017. And 2014, till 2014, they were getting different ration or different from UNHCR. Later on, that ad was stopped by the government and UNHCR because that their priority shifted to the Syria, because Syria conflict started in 2013-14. So what happened that people, when I was interviewing them, they realized that government is starting a new program and they are going to give ration to them. So they were in a view that we should give the information for which we should be considered eligible participant again for that. So that was the reflexivity. So I just later on that triangulated with different things, like I just observed with taking pictures, that where they're, how they are living, what are their living conditions, what are their dwellings, how different logistics are provided in the healthcare facilities nearby or not. So that is kind of triangulation. You just want to increase the rigor of your qualitative research study. That is validity and reliability. I mean to say that quality of data is improved by triangulation. Now, what are different types of qualitative studies? Have you heard of any qualitative research study designs? Any research study design of qualitative? दो तीन तो खुदा के बंदा मैंने शुरू स्लाइड्स में खुद ही बता दिया था. This is phenomenological, ethnographic. Okay, let me just, there are many, but key ये 6 मैं बता देता हूँ. Just let me tell you. One is phenomenology, ethnography, case study, grounded theory, historical research, and action research. Phenomenology. What is phenomenology? 2 slides on each study design, and then we are done with the qualitative research study design presentation. Phenomenology is used to explore something that is experienced something on earth as a person. It deals with sensory experience that makes you perceive or understand things that naturally occur in one's life, such as death, victory, defeat, caregiving. Let me give you an example. This was the study which I was talking about that was recently published in July. Here you can see that it was published in July 2024. And this is cultural adaptation of a respired program for caregivers of mentally challenged children in Pakistan, a qualitative study. This is the phenomenological study. Okay. And you see, this was the phenomenological study. This was conducted in here. And this was Kurdish Studies, is a W category, I think UK or US journal, very good repute. It has a very good impact factor. I think it's they are charging Pakistan $400 or $500. I think that is 5-6 people, that is manageable, because many of us, we are reluctant to submit our article to international journals because we consider it that the article processing charges are very high and we cannot afford, and we don't have any institutional support for that. This is another phenomenological study. This was, again, I was part of this study, and I was the corresponding author in this. Here you can see perspectives of healthcare. This was also published in 2023, no, 2024 probably. This was published in March 2024. So perspectives of healthcare workers and integrated management of childhood illness in Pakistan, a phenomenological study. We are part of different training with UNICEF. I am the master trainer as well as the course director in integrated management of childhood illnesses, IMNCI, that is a abridged course of 6 days. So those people who received this training, there were 2 different groups. One was who received 6 days training, and there was another group, healthcare personnel, who received 11 days training. And then we just wanted to see that that IMNCI guidelines are properly implemented in the field or not. So this was another qualitative phenomenological study published. This was also published in an international journal, American journal. The journal name was Journal of Child Healthcare, US journal, with 1.3 and 1.9 impact factor. So this was phenomenological study. And that second is ethnographic studies. involves study of a certain, I just give you people example in my previous slide that if persons are the researcher, he is interested to study the culture norms of an area, so he or she should immerse in that settings. And that is the ethnographic. And ethnographic study, the data collection is only to observe things. A certain cultural group of organization in which the researcher has to obtain knowledge about the characteristics, organization setup, and relationship to the group. Researcher actual participation in the group is mandatory for that. This is example of an ethnographic study. It is very difficult and time consuming to conduct. And we Pakistani, we do not उस चीज में हम नहीं कूदते जिसमें टाइम ज्यादा लगे या रिसोर्सेज ज्यादा लगे. So I was not part of this ethnographic study. The culture and of an emergency department, an ethnographic study. Okay, this was you can just further you can explore it that how this was conducted. But yes, there are in our setup we can do this ethnographic studies because we have the tribal areas, we have different ethnic groups in our here in Khyber Pakhtunkhwa. So this is the setting is there for us that we can also do this. That is a case study. Describes a person, a thing, an event or organization. For example, in our study, this was the research study, which was I was the principal investigator. And this was basically, this was my doctorate thesis when I was conducting. My PhD was on this IDPs. So this was one of the qualitative research study. That is the case study. Manages perspectives on the devolved health system response, because in 2009 the health system was devolved to the provinces to the public health needs of internally displaced persons in Pakistan. A qualitative study. This was the now what was the case over here? The health system was the organization, or because we are here we see that describe a person, a thing, an event or organization. So organization for the health system of Khyber Pakhtunkhwa. It aims to determine why a person, thing, event, organization acts, behaves, occurs, or exists in particular manner. Data collection methods, observation. Yes, observation was there. Questionnaire was there. Were two different groups were studied. One was the IDPs. Focus group discussion was, and in-depth interviews were conducted with the participants. Key informant interviews were conducted with the health managers of KP. And this was studied. This was published in 2021. Again, this was an international journal, Health Security, US journal with very good impact factor. And this was free of cost. Grounded theory, it's a bit tricky because we have, initially you have to interview in some area, you have to develop a theory, and then later on you have to keep on, different groups are involved in this. It is a bit the most difficult study design and qualitative, that is the grounded theory. Aims to develop a theory to increase understanding of something in a psychosocial context. It takes place in an inductive manner, wherein one basic category of people's action and interactions get related to second category and third category, and so on, so on, so on. And this, for example, this was quality of care from a patient perspective, a grounded theory study. You can explore it, that how this research study was conducted, how the data was collected, what were the different steps involved, and how it was compared to different groups. This is a historical study. It determines the reasons for changes or performance of things in physical world in a certain period. Yes, this study can be conducted in a qualitative part. Like you can say that when this KTH was established, initially the participant, there were this much number of departments were involved. Later on, the departments were included, and then the OPD was increased from this to this. This is historical study that you see. It determines the reasons for changes or performance of things in the physical world in a certain period, years, decades, or centuries. Data collection methods, biography, autobiography, documentary analysis. That here in KTH, I give you an examples. You can do this documentary analysis, and that will be a qualitative research study. Nursing care in a state hospital before and during the introduction of antipsychotics. Now see, at the span of 15 years, this research studies was conducted. This is another historical review of medicinal plants usage. This can also be because we have this herbal medication or homeopathic medication in our setup. you can just simply, you can replicate the same idea here in in your setup. And then the last one, I think this is the action research, is a type of qualitative research that takes action to improve practice and study the effects of the action that was taken. And for example, here you want to improve the services here in KP. There is a very good example of this MDI. Like in 2015-16, the MDI Medical Teaching Institutes, autonomous bodies, this MDI Act was launched in 2015-16 probably. So before that, because this was the one of the part of this act, you can do this action research on that. That what happened after that, after implementing this MTI rules, and by making this institute an autonomous. So is there any improvement or not? Okay, so this is kind of, the research is a type of qualitative that seeks action to improve practice and study the effects of the action that was taken. Solutions, now what is the act? इसमें क्या होगा? इसमें there is implementation of this your MTI जो आपका वो है act है. Solutions are sought to practice problems in one particular hospital or healthcare settings. And see, this is the example of this action research. A research study to identify facilitator and barriers to outcome measure implementation. This is also linked with public health. So this is my last slide. This was all about this qualitative research. But this is my last slide. This is take home message from my side, that is qualitative research needs to be particularly skillful in writing, because, but मैं इसको थोड़ा सा at this moment I will try to rephrase it. मैं कहूँगा कि the researcher should not be skillful in writing. The researcher should be skillful in using AI tools nowadays, जो कि आपके पास मुख्तलिफ Grammarly and जो हैं, लेकिन उसको again you have to paraphrase those all things. So how good you are in using those AI tools? Yes, you are a good writer then, because everything is available at your desktop. So Furqan, this was all from my side. And if there are any questions, because I have not opened that chat box, maybe there are a few questions from the participants. And if there are some questions, please let me know.
Thank you so much, sir. Thank you so much. The feedback form is shared in the chat box. Kindly fill it up because it's necessary for your marking your attendance. So we almost don't have enough questions right now, but there's this one from Mariam. Mariam, would you like to turn on your mic and ask your question directly? Mariam Tariq.
Okay, Assalamu alaikum, sir. I hope you are doing fine. Firstly, it was an amazing presentation. Basically, I'm doing a qualitative research. I'm a fourth year MBBS student, and I'm doing on the perspective of medical students regarding the medical education system in Pakistan. So I'm a bit confused that is it phenomenology or grounded theory?
Medical education, and I think it's a phenomenological research study. Again, I have shared the slides will be shared with you people. You just have to explore. You can do this grounded theory, but at this very moment, I think it is very technical and very, I will not suggest for grounded theory, because there are different technical things which are involved in this. Ideally, it should be your phenomenological study, because you are studying this phenomena, that how this undergraduate students here in KMC, that after the medical education या उसके बाद जो भी आपके different वो implement हो गया है. So currently what they believe, what they have their perceptions regarding this आपकी जो medical education का वो है. So I think this is in your case, that will be a phenomenological study.
Okay, thank you, sir.
So there is a remark by Dr. Alina Bacha. If you want to have a read of it, it says that I would suggest we definitely need another presentation on the analysis part of qualitative studies.
Yes,
so I think you actually mentioned that in your workshop thing.
Yes.
I want to tell
this
you
was
that
just an idea just struck me at this very moment, because it is the list. I have that list of workshops, pre-conference workshops, but in those workshops, there is it is not included currently. Let me talk to Dr. Iqbal Haider, and yes, we can discuss that. Why not this will just give you the flavor of qualitative research studies, that what are the different study designs, what are different data collection tools. But I will be more interested to just to present on, for example, taking one of the case study, like one of the research study which was conducted, either phenomenological or case study, how practically that research study was conducted, and how it was starting from the proposal development, from the literature review, how the idea was taken, how the rationale was developed, and then later on, what was the methodology section, what were the different tools or techniques which were used for data collection, and how the data was analyzed, how it was transcribed, how the themes were generated, sub-themes were generated, and how these themes and sub-themes, they were presented in the results section of the published research studies. So I think that will be that it requires a session of 1 or 2 hours, how you are going to, and yes, in that same session we can do that, how you are going to do that manual transcription, how you are going to generate themes and sub-themes from manual transcription, and how you are going to use those softwares which are freely available and used in qualitative research studies analysis part. So for example, I gave an example that the NVivo is one of the software which is commonly used for data analysis in qualitative sections. So yes, let me talk to him, and I will share the details later on.
So he is here with us, and Dr. Iqbal is here with us today, and he actually has mentioned in the chat box that it's done from his side.
Okay, sir, thank you so much. Because yesterday we were discussing, you were asking me that choose a topic for yourself for your upcoming research workshops. So I think this is the proper time, and this idea just struck at this very moment. So I think the idea would be that why not we should do a research workshop on qualitative research conduction, that is proper research process, how you're going to conduct a qualitative research, a qualitative research, I mean to say, which is worth publishing in international journals, because this is very few of us, we are indulged in qualitative research in our setups, that is at undergraduate or postgraduate levels. Yes, there are few of the students which are under my supervision, they are doing qualitative research, and I know few of students, because Dr. Iqbal Haider himself is a very kind enough officer that आपने foreign approval दे दिया.
Dr. Imran, thank you so much for such a nice webinar. I totally agree with you. We will allot 2 workshops to qualitative research. So you please select your topic along with learning objectives and just send me after this webinar. I will definitely include it. The first workshop will be regarding the basics and the subcomponents, and with the real life examples. And the second will be yours one, which you described. So we are more than happy to include it.
Thank you, sir. Thank you, sir.
With this, I thank you all for joining us today. This was our last pre-conference webinar. As you can see on the display, that our research conference will be held on 2nd and 3rd of October, and we will have some really amazing speakers for our pre-conference workshops over there as well. You can register and submit your abstract for poster and verbal competitions through the KMC website, which you can access simply by putting Khyber Medical College in your Google search. With this, I say thanks first of all to the Student Research Committee members, Sara Yusuf, Areen Arif, Omar Afridi, Zmarak, Ahmed Abdullah, and Sundars for helping me out throughout this webinar series and putting in efforts to make this possible. The CRC member, the college research members, Dr. Jahan Yusuf, who is also the chairperson for Student Research Committee, Dr. Rubina Gul, Dr. Zia, and Dr. Mohsen Shafi, and the one and only Dr. Iqbal Haider, jinki efforts ki wajah se today this is possible that we actually have had this 15 webinar series before the conference began. With this, I would like to say thanks to our Dean, the Patron-in-Chief for the conference, and everyone, Junaid from PGMI, Mr. Junaid from PGMI, who actually helped us a lot in the technical issues. Here, all the personnel who are working here in the SLRC, and with this, I would like to remind you that the feedback form is shared in the chat box. If somebody is left in filling that, kindly fill it up, because it is necessary in marking your attendance, as well as it helps us improve with every activity that we design. If there are any further questions, the speaker is here with us, and if you want to ask any questions, you can obviously raise your hands or type in the chat box till the time is not up. If there are any other questions, you can always raise your hand. I think there is none, sir. Thank you so much, Dr. Imran, for joining us today, and thanks.
Thank you, Furqan. Thank you, sir. Thank you, Dr. Rubina. Thank you, John. Thank you, Zia.
Thank you everyone for joining us today, and thank you for all the efforts that you put in for making this workshop a success. All these recordings of the workshops are available on the YouTube channel of Research Cell Khyber Medical College, which you can easily access through your YouTube. And with this, I would like to say Allah Hafiz. Thank you so much, everyone.
Thank you, Furqan. Thank you. Allah Hafiz. God bless you.